the Benefits Committee meeting of June 27th, 2022. So we call this meeting to order. We have Squire Muller, who is on camera, on video, and Squire Sebastian and myself here as part of the Benefits Committee. We have Jamie Bennett here to talk today about year-to-date financials and several other items. And so, Jamie, we turn the meeting over to you. Thank you and welcome.
Thank you. I certainly appreciate the committee taking time to meet with me today. I know you all have a lot on your plate right now. Probably the biggest thing is trying to find someone to step into some pretty big shoes to fill.
Yeah.
Which I'll stay on that subject for just 1 second. Susan, I'm going to rely on your young brain, and because mine's old, but I think in my tenure in working with the county, which is a little over 20 years, we have examined self-insuring at least 2 and possibly 3 times. Does that sound about right?
That sounds about right.
The issue in the past with self-insuring is, if I say risk, typically employers, even governmental employers, are risk adverse. With 150 or 140 or 130 employees, that has been my hang up over the last 2 generations, is that the risk was not getting spread adequately in order to make self-insurance something that the county could do safely. I'm before you today telling you that has changed within the last couple of years. With, number one, I merged with a firm out of Lexington called the BIM Group, which is a UBA partner, and UBA stands for United Benefit Advisors. They are an invite-only organization. It's not something that you can just pay annual dues to and become a member of. It is the elite of the health insurance brokerage world across the United States. And the long and short of it is, I can walk you through each one of these exhibits and answer any questions that you have, but knowing your plate and knowing what's on there, I also will tell you that the long and short of it is, before I spend, and I get our analysts to spend 15, 20 hours analyzing joining the UBA consortium versus staying self-funded, before I invest that type of time and energy, I wanted to make sure that the court was comfortable in pursuing a quote. I'm not saying commit to going self-insurance. I'm saying entertain the possibility of going self-insured. We're coming off a couple of years. Susan, I believe we've had 2 rate holds and maybe a rate reduction in the last 3 years.
Yeah, see the smile on my face?
Yep. I also know that Betty Jo did a peer study of surrounding counties, and what we did find is that our rates and our benefits are outperforming anyone else in the region right now. I would go a step further and say you're running well again this year. If we look at a rolling 12 months, and we only have data through April, but if we look at a rolling 12 months, you're running at about a 75% MLR, or medical loss ratio, which means for every dollar you all are paying in, 75 cents is going to a claim of some sort. That leaves 25%. And where I'm going with this is now in my humble opinion, now is the time to look at self-insuring, not because we're having problems and we're expecting a 20% or a 30% rate increase. We're probably looking at another year of a flat, if not maybe another 5 or 10 point reduction. The problem with that is that still leaves 20% that went somewhere, right? Everybody
Right.
following me? Okay. Where'd that 20% go? Well, it went to the insurance company. If you self-insure, that corridor or that risk corridor goes back to the Franklin County Fiscal Court. It puts you in control. It gives you an opportunity maybe even to get, maybe in a couple of years, a little more generous to your employees. I know the court was kind enough to do some funding towards the family and the dependent coverage this year. But I'll be happy to answer any questions that you might have about the materials that you have, or we can go through it slide by slide, whatever you all prefer.
Jamie, once again, and I hear that puts us in control, but what really are the benefits of going to self-insured over something like Humana, a big corporation? Who would you end up, would self-insured end up having to have some type of catastrophic or some type of insurance?
Yes, you buy reinsurance going into a year, and there's one slide, I don't know if Andrew can get it up on there, but there's a great comparison between self-insurance, the UBA consortium plan, and fully insured. And the biggest difference is if you go self-insured all by yourself, you're spreading the risk amongst 150 people. That's not enough. If you keep going down, down, down,
The partnerships, is that it?
there, you're almost there. Whoa. All right. When you have a high cost claimant and you're fully insured, you're rewarded with a 25 or a 30% increase, which takes me to go to the other carriers, try to get them to get involved, but you know that you're going to be hit with a substantial rate increase. It's a race to the lowest, if that makes sense. But what happens as things stabilize after that cost claimant, they never readjust and drop your premiums back down to where they were. The functionality of it, Judge, also is just like Betty Jo and Susan are doing now. We establish a premium, and that premium will include money for claims. It will also include money for the reinsurance. That reinsurance is covering the county as people hit their deductibles. That is a specific, there's a specific deductible that is hit, and then the insurance picks up, and then an aggregate. But she pays a premium just like she does right now. The only difference is it wouldn't go to Humana or Anthem or United Healthcare, it would go to the bank of your all's choosing and everything would flow out of there.
So what happens to Betty Joe's insurance? I mean, who does she go to the doctor to go see? Who does she go and schedule a surgery with?
Yes, in this particular case, we're utilizing United Healthcare's network. So she has an insurance card that says United Healthcare on it, just like she has an insurance card now that has Humana on it.
And so what would she pay? Would she would she have a deductible that would have to, or a copay to go to the doctor? How would that work?
We set the plan up in plan design however we want it. My suggestion would be to mirror as closely as we can your current benefits.
Okay. And so are you saying that there is a savings, a significant savings?
Yes, sir. Yes, sir. I mean, I'm talking, if you run like you ran this year, I'm talking 6 figures.
In savings?
Yes, sir.
Without loss of any type of coverage or anything?
No, sir.
You're asking us as a committee to allow you to look at the figures, not if you look at I guess because it's not even July 1st, you're needing that time to get those figures ready to bring
Yes, sir.
together before sometime in October or whatever you do it?
Yes, sir. Before I invest hours and before I ask some analysts at BIM to invest some hours, what I was asking the committee to do is to say, we will consider self-insuring. We would have to make a decision. Typically, we try to have it done by October 1 so that we can get the open enrollment in and done.
Okay.
I will say this, and this is what I want to make sure we understand as a point. The United Benefit Advisors Consortium has approximately 50,000 people spread out throughout the United States as members. It's over $2 billion in premium annually. That's why I think it deserves a look and deep consideration, Judge. Is not because we're not going to set up a self-insurance fund on 150 people. We're going to look at or explore joining a group spread out throughout the United States comprised of 5,000 employers and 50,000 people. That adequately, in my mind, spreads the risk.
Okay, so it would not, so if we had, I'll go to Betty Joe. If Betty Joe unfortunately had some major surgery and is very costly, couldn't come to work and et cetera, et cetera, et cetera, that would not affect the self-insurance rate that much?
It wouldn't affect it as much. And in addition, within the UBA, you have rate caps built in so that once you join and become part of the UBA, they cap your amount of rate increase as not being able, I want to say it's 9 or 10%. So, in that really, really bad year, you're not going to get hit the next year with 30%. The worst it can be is 10%.
Okay. Susan, I want to hear what you have to say.
Jamie, are those rate cap increases custom to each plan or that's the whole consortium?
That's you individually. You are guaranteed that your rates will not will not increase by more than 10% a year.
For just Franklin County, that's not everybody in the consortium.
That's everyone in the consortium has a separate rate guarantee.
Okay, so it's custom to the plan, like your whole benefits
That-
grid. Or, yeah.
That's right.
Squire,
We have had United Healthcare fully insured program in the past. And I don't recall any network issues, but we also will do a mapping overlay to make sure that we're not losing any hospitals or providers in the immediate area.
Okay, Jamie, this is Betty Jo. I have a question.
Mhm.
So monthly, like, do they send? I guess my question is, do they send us an invoice monthly and then we
Yes.
get United Healthcare, or do we pay as the claims come in, or?
No, nothing changes operationally for you all, other than you're not sending or making a check out to United Healthcare or Humana. You go make a deposit into a bank account that you establish, you're the owner of, but you're giving authorization to Benecom, who is the third-party administrator.
And they pull from that account.
They do all the functions of your insurance that a Humana or an Anthem or anybody else would do.
Okay. And you also said that, would it be an option still with the 3 providers like United Healthcare, Anthem, Humana, or not?
No, the UBA consortium plan is tied to United Healthcare.
Okay, I just wanted to make sure I was clear on that part. Okay.
Yes, it would require a move from Humana to United Healthcare. Now, before somebody asks, I'll go ahead and say it. You also lose Go 365.
Well, haven't been working very well this year, so I'm not too pleased with them. Along with the other employees this year, it's been a little bit of a,
so will we be able
Issue
to
with-
cash all of our points out?
Absolutely. I think they stay around for 18 months or 2 years, Judge. You don't lose anything because we go to a different insurance.
what type of wellness benefit do they have?
They have a program called Care Connect. It also includes not only wellness programs, but disease management programs. We do have a couple of conditions if you all want to look through some of the info that was sent. And again, it's all, you don't know who it is, but we do have an active diabetic within the plan right now. They will reach out to that individual, and they also, as part of that Connect Care 3, they will include the telephonic office visits, where someone might think they have strep throat, or you're trying to decide if a cut's bad enough to go to the emergency room or not. You've got a 24-hour number that employees can call. And what's neat about that, Betty Jo, and I want to make sure everyone understands, the cost of those services are included within the premium you're paying. So you've got a premium that you're paying, and then you also have a claims fund. Okay? If they use those telephonic services, that money's already already been paid for in the premium, you don't have to take it out of the claims fund to pay for that visit. Everybody with me?
Okay, could we, I'm having a question about the wellness still. Say if, I'm just throwing this out there for an example, we have not talked about it. Just say if the benefits committee decided they wanted to make sure that, everyone received a physical, okay?
Okay.
So I'm just, it's a pure example that, you know, they would like to see for a wellness. We still want to continue our wellness here at the county.
Right. You
If
still,
we did.
you still want to do biometric screenings. Is that what you're saying?
I'm just throwing that out there for an example, but yes.
We absolutely can.
And could that be automatically sent to United Healthcare so we would know if someone didn't have a physical?
That's a question for whoever we get to do the biometric screening.
Okay. I'm just
You know,
throwing that out there because I believe our benefits committee would still want to do some type of wellness, non-wellness rate. I'm assuming, I'm not for sure. I just
Well,
wanted to,
I couldn't agree more.
okay.
So Joe, how many employees do we have paying the non-wellness rate?
0.
I haven't heard from Squire Muller or Squire Sebastian. Let's let them ask questions, make statements.
Hey, Judge, I'll go ahead. Sorry I couldn't be there again, and I'm not having good reception, so I'm not going to try. Hey, Jamie, thanks for looking into this. My question's going to be looking at the negative part of this. Let's say we do it. Unfortunately, some things go not well. Our rates go up, 9% each year, I think you said was the cap. Would that hurt us going back into the system we are now? Let's just use Humana, for instance. So we try this for a year or two, it doesn't go well. We decide we need to go the other direction. Are they going to quote unquote hold this against us, or what does that look like?
No, they're not going to hold it against you. But I do feel confident, Squire, that if we elect to go this route and we get 3 years into it, we wouldn't even want to look at being fully insured again, regardless of what our numbers are. Because if you have that really, really bad year that you're saying, what happens then? And we want to get out. Well, that's no different. Right now we're fully insured, and the risk of having that bad year and affecting our rates, it's greater now being fully insured than it would be in a consortium.
Yeah, but his question is, and I think you answered it by saying we don't want to go back. So so once you're in this, you don't.
It's a 1 year. It's a 1 year agreement. It's a 1 year agreement, Judge. You can get out of it at 1 year or with 30 days notice. I'll have to check, but I feel strongly enough about how this is performing that 3 years from now we're going to look like geniuses.
Okay, Squire, Michael, that's a good question. Once again, Jamie, it's not really about us sitting at this table. It's about the employees, about their health care, about their cost and all that. And you're saying that the health care is not going to change, right?
It will change, Judge, but it will change to the employee just like it would change if we moved from Humana to United Healthcare fully insured. It's no different than we've done in the past where we have, we've had Anthem Blue Cross, we've had United Healthcare, we've had Humana. it's no different if we try this a year or not. I mean, it's going to be like we switched to United Healthcare in the eyes of the employee and in the eyes of their providers.
When we have done that before, the question has always come up, is there, and I forgot what the word is, a
In there.
continued coverage of existing issues?
No, pre-existing conditions are a thing of the past. That's part of the Affordable Care Act.
And again, and also I think he's wanting at the doctors. They want to make sure the doctors are in network.
Yeah, that's what I was saying, Betty Jo. As part of our analytical process, we'll do a geo access, which is report, which basically says with Humana, you have this many doctors and hospitals, and with United Healthcare, you have these.
Right, okay. And we could also mirror the plan. Like right now, we have $1,000 deductible. and
Correct.
$6,500 maximum out of pocket. So we can, if we
Correct.
want to keep it the same, we can mirror the current plan we have now, like the $25 co-payments and so forth.
Correct. And I guess where I'm going with this is, in the short term, we're not going to see that much effect, not in 1 year. In the long term, 3 or 4 years from now, and we've created this surplus of funds in there, which essentially was profit for the insurance companies. Once we've established that surplus, if you all want to go back and take money out of the fund and lower premiums for families again, or if you want to lower the deductible to $750 instead of $1,000, you can do that. The Commonwealth of Kentucky, for example, has been self-insuring for, golly, at least 25 or 30 years. But typically what happens there, I've seen it over and over again, is they build up that surplus and then it winds up going to some representative's pet project up for a road or whatever.
Yeah, Jamie, how much how much is that co-insurance gonna cost us?
It's going to be minimal in comparison. And it's not co-insurance, but it's reinsurance.
Okay, I'm sorry.
It's
I was wondering how much-
reinsurance. It's going to be built into whatever premium we come up with. For example, what's our premium now?
$5,300 a year, something like that.
Okay, it's going to be built into that 5,300. They're going
Okay.
to take out enough money to pay for their claims. They're going to pay for the reinsurance.
Sherry, you got something to say?
Yeah, I've been sitting here quietly. So it appears to me that monthly claims are going to fluctuate. We're not going to have the same illnesses every month going into this process. So does that create some kind of draw or drain on the fund? Because
No.
we won't have the same claims every month. You know that. I mean, there'll be months where it'll be claim heavy. Winter, there'll be people going to the doctor right and left for whatever. Okay,
Yes.
summer, hopefully not. And
Right.
potentially, none of us know when there will be some kind of catastrophic situation, whether it's an illness or whether it's an accident.
Yep.
So how do those C changes affect the fund?
The fund will have months where you'll have $75,000, $80,000 in claims. You may have another month that has 125. But in the end, it's all going to balance. It's all going to balance that, and we'll set your rate at a point. Sherry will set the rate, the amount of money going into the claims fund that covers the maximum liability possible.
And so how do we gauge what the maximum liability possible is on this end before we get into it?
Well, we can take the max out of pocket on however many people are on the plan, and that's gonna come close to your maximum liability. If you know that I have 150 employees and $5,000 is the max out of pocket, multiply the two, and that's your maximum liability.
Mhm. And so how do we, let's presume, how do we build, I don't know if equity is the right word. How do we build this fund? And let's say the first month, I'm just trying to figure out how that works so that there's not these huge.
Because analytically, I don't know what could occur to have, 20% of the population of employees to hit their max out of pocket in the first month.
Tornado or flood could happen. I'm just trying to figure it out.
Well, we're
You
not
know,
worried about
because
our, if we have Noah's flood, we're not worried about our insurance.
we have to, unfortunately, at the county, we have to be worried about every person's everything.
Okay,
We do,
all right.
that. So I'm just trying to, because, I've sat here now for, 3.5 years. And
Right.
never once have I heard self-insurance. I've heard our brethren across the river bemoan self-insurance for holes that it has dug them into in the past,
Yes, all
that
right,
they have climbed Muhammad's mountain to get out of.
yes.
And so, first time breath I've heard of it, and now it's, man, it's like I pulled the
Sherry,
thing off and it's the best meal
Sherry.
out there. So I'm
Sherry,
trying to figure,
I understand completely.
that's flipped.
I understand completely, but please follow me and try to understand.
I absolutely am trying.
Okay. Self-insuring in the past would have meant spreading the risk amongst 130 people. The consortium puts you in a pool of 50,000 people.
I heard you say that earlier. First thing
Okay.
you
All right.
said, I heard.
Is your risk greater spreading it out amongst 150 or 50,000?
Well, I know when we brought up working with whomever is insuring a number of other counties, one of the things that was lobbed against that was, it's the sickest of the sick in that pool. So are we in a pool with the sickest of the sick?
No, ma'am. The average rate, the average renewal for everyone, and again, it was over 5,000 groups last year. The average, the median rate was negative 2.9%.
So we're in this consortium because we're doing so well. Is that what you're saying?
No, because the BIM group which is who I have now affiliated myself with, is a member of the United Benefits, the UBA,
Right.
okay? It isn't available to any other broker within the Commonwealth of Kentucky. It's exclusive to BIM.
All right. Well, I think what you're asking is, in my opinion, is by all
Yeah.
means, take a look at all you're asking. You're not asking for us to approve it. You're asking for you to get us an analysis, right?
Absolutely. Do you want us to invest some man hours, and what we'll need is, we'll need the renewal, we'll need claims data, which we have, but before we invest those man hours. I wanted to expose the court to it. And then secondly, make sure that it's something that hopefully everyone understands and what makes it different, and decide, is this something that we want to consider?
Well, I'll say the prospect of court making a change, I'm not a gambling person, but is zero. I think you're gonna waste your time with the effort personally. I think that, you know, again, the concept, I mean, Squire Sebastian just said, you have, is a big thing to overcome with self-insurance and the idea, you know, being with a bigger group certainly makes sense, makes a lot of sense. But how many government employers are in that group? And government always acts differently than private sector. I mean, and one of the problems at the city, I think, was because they had control over plan design and they made it luxurious. And with that plan control, you get pressure from your employees and constituents, you know, about how to control the plan. And you've got a special situation. So now you have the ability to control the plan to accommodate, you know, your population that are covered. The cash flow issue wouldn't be such a great thing maybe for Franklin County, but it is a consideration. You know, government put stock in predictable fixed expectations, even at the cost of saving 6 figures. So I would be my say that, first of all, this whole court's going to change. Is changing. I think, you know, there's so much change going on right now that I think there should maybe be some conservatism and and there probably will be for making changes.
Yeah.
But because of the lack of knowledge about what's going on and maybe even how to administer this program. So, I mean, I know we have the flexible spending account, HRA situation in our administration of TPA with McGregor, and where we put money in to that fund, and we've gotten an accumulation of, off the top of my head, I don't know how much it is, but there is an accumulation, but there is local administration effort, even with the TPA, you know, and just an understanding of a whole new concept, even though you're maybe paying someone to be carefree and you have a reliable broker such as yourself, there still has to be an element of education and understanding, even to provide minimal oversight. So, you know, and then we have the thing that is really even makes it more hesitant. We've had such great rates. We've had such great renewals. We still have the prospect of some additional savings, hopefully, for this renewal period that we can bank on. So that even though we may miss out on a year, I would think that this would be a question for a new court, new administration, and with, again, and you know this, Jane, you probably expected to hear all this from me because I said it under the self-insured stuff, is an opportunity to invest some time here at this table in education on this concept. In the bigger group and risk, you know, assessment. So there's 3 cents or 4 cents.
Susan, I understand and agree with everything that came out of your mouth. But the thing that I would like to leave the committee with is, if you empower us to request a quote, get our analytics folks started on it, it will do nothing more. Even if you come back in September and say, we're staying right where we are. The fact that we will be able to tell Humana, tell Anthem, tell United Healthcare that we are quoting it with the UVA consortium, they will get their pencil sharper.
Can I pick up on that point? Last year, we were told that we didn't want to go out and appear that we were requoting anything because there might be some punitive backlash from our carrier. So what has changed in that regard in less than a year?
Who told you that, Sherry?
We heard that here at this table. We didn't want to go out and requote anything because it could come back higher. I remember that very well.
I'm not saying it didn't happen, but I am saying that when you're, oh, I know what it was. It was that we got the renewal in August or something, that if we said yes, then we were locked in. That's all that was.
Yeah, that's right. I do remember that. Yeah.
There
Yeah,
was
it
a
was-
lot of discussion about the requoting of things. There was a lot of discussion about that.
Humana put a flat on the table and said, if you will accept this prior to such and such date, you got the rate hold. If we didn't accept it by such and such date, there was a possibility that it would increase.
I do.
That is 100% accurate.
Or if we went out to get other quote. it would-
Correct.
Oh, it would have increased. That's
So
what
I'm
she's
just-
referring to.
Yep, so that's why I'm trying to figure out why the circumstance is a little different this time. Just,
Because we're talking about an entirely different mechanism. We're talking about self-insured versus fully insured. We're not talking about going to Anthem for another quote, or I would expect Humana's going to do the same thing they did last year, Sherry.
but are we going to, so stepping that out, I appreciate you bringing that up because that was the next question. For me, are we going to, as they say, Smokey Robinson said, are we going to shop around and see what else is out there? We might have Humana now. Are we going to look at Anthem and others to see, because you indicated, I think when we first started, we're looking at maybe the same rate potentially if we stay
We could,
similar to what we're doing. It may stay the same. It may drop a little bit. And we've had history. I think you've presented that several times, like a 10-year snapshot of how things have been at one point. Seems like I don't have my folder here, but I remember at one point we saw a snapshot of how fortunate Franklin County is by staying kind of the course that we have now, because it's somewhat predictable and financially predictable. If we move to this other situation, it's not as financially predictable.
that's where I think we have a difference of opinion, and that is self-insurance through the consortium is risk-free. And fully insured is risk-free from a standpoint of you get a 1-year rate guarantee. You get a 1-year rate guarantee whether you're fully insured or self-insured. But I have with the consortium a guarantee that it won't be more than 10%. I don't have that guarantee with Humana or any other fully insured carrier.
Does the consortium have any data showing what type of increases or decreases they've had over the past 3 or 4 years? Is there a history?
Absolutely. Yeah, we can give you all that. We can get all that historical data, Judge, if you'd like to see it.
Okay.
The challenge you're presenting the committee with is, we're only a few members of the court. You presented it as, I really don't want staff to have to go through this hoop jumping of lots of legwork and then it all be for naught. And the problem is the committee doesn't have a codlock on what the court's going to do. I mean, we've taken several things to them and it may not have happened the way the committee voted it out.
I think
Right.
that's what saying too.
I-
But, okay.
I'm just
so-
saying.
So really the questions are this, in my opinion, is it gonna cost us more to have you do this analysis? 2,
No.
that's 1. 2, does are you still gonna be brokering for a non-increase or a possible decrease with United? Or Humana? Okay, and you're brokering that. So you're doing, there's no cost. In the end, we look at it and we've always, this committee's always done the recommendation of sending one recommendation to the fiscal court, what they want to do. We could bring this, obviously, you'd come back and you speak to the court on what the recommendation of the benefit of the committee recommends anyway, right, Jamie? Haven't you?
We have in the past, within the committee, gained consensus every year, as far as I can recall. I don't think the committee ever went in and said, well, we couldn't decide, so we're going to take it before the whole court. But I'm not asking for consensus. The only thing I'm asking for today is, are you intrigued enough and are you interested enough for us to invest the time necessary to produce a quote through the consortium? If the answer is, even if we got a great quote, we've got so much going on that change is not a possibility, I'll know then, after today, that, we're going to stay fully insured and I need to start negotiations with Humana, United Healthcare, and Anthem.
Hey, Jamie, it's Michael again. Can I ask a question?
Sure.
How much information are you going to need from, say, Susan or, Franklin County staff in order to look at this?
Nothing.
You're gonna need a
Already.
census.
Already, a census maybe, but I already have access to that information as your broker with Humana.
So so you said you've partnered with this new firm. So do you still represent people with Humana, or is that okay?
Absolutely. I am your broker with Humana.
Okay.
But to clarify, Jamie, you will need a census, correct?
Yeah,
From
that's
us.
correct.
Right.
Yeah, that's going to be the extent of it, because we're already getting the financial data, claims data, and you have it too. It's included in your packet.
All right, Michael, what say you? Have him look at it, bring it back to us, or? don't even-
I'm kind of torn. Everyone, Judge, you and Sherry and Susan have all brought up valid things. But at the end of the day, if it's not going to cost us anything to look at something, I don't see any harm and foul in that. But Jamie, I do want you to know, especially with knowing what, the kind of city went through, that we have a lot of hesitation. So as long as you and your team go into this knowing that, we're definitely not heading in that direction, it's a possibility. I'm okay with it.
As far as Sebastian?
I'm worried about getting upside down in a policy. I'll just tell you, I'm worried about it.
So you say no?
So, well, I mean, Jamie presented it, it's like, I don't want to have my staff, and Jamie, I'm kind of going to parse words here, spin their wheels if this isn't going to go anywhere. And again, like I said, I can't speak for the court. I can just speak for what I was able to get out of this presentation. And I would hate for us to get into an upside down situation. So that's where I'm at.
Okay.
So, I'll go with Squire Muller and just have you look at it, bring us back at it. Not saying we'll go with it. Fine with me. I think options are always good. I don't think there's anything wrong with options. We'll see how it all plays out. There's a lot of questions, a lot of concerns, and they're all legitimate. But options won't hurt. Options don't hurt as long as our staff is not having to spend a lot of time, and you're all are willing to look at it. So with that being said, the vote is in favor of you going ahead, Jamie, and well, when you get all that information and you have other information from the other healthcare providers, let us know and we'll come back together.
I think also that I will, Judge, with your permission, I'll try to get to the court. I don't remember who, but someone asked a very valid question, and that is how many governmental entities are in the consortium now?
Treasurer.
Yeah,
But if
I
she
will,
hadn't asked, I was gonna ask.
but that is a good point, and I'll take that and try to have that info back to Tambra and Betty Jo in the next couple of days. But again, I'm not telling you that, you know, insurance is not still going to be expensive, because it is. But I am telling you that, in my humble opinion, of 35 years in this industry, this is worth looking at.
Okay, and we're telling you, go ahead and look at it. We'd like to see the data, the analysis of it, and we can weigh from that point. You're giving us an option to look at.
Sounds great.
All right?
I'm
Everybody good with that?
I very much appreciate everyone's time today.
Jamie, is there anything else that we need to discuss, Betty, on benefits? All right.
No.
Jamie, okay, thank you so much for looking after, I think the important thing here is that you're looking after us, and we appreciate that. Thank you for being a good broker.
Happy to help. If I can do anything for anybody, just give me a holler.
We'll probably will, so hang in there.
Susan, I'm gonna miss you.
Yeah.
I'm not missing it. But thank you. Yeah, we'll be talking.
All right, is there a motion to adjourn?
Just very quickly, so what will be the turnaround on this, do you think?
I'll have it, depending on the backup, but I'm saying I'll have it in a month, 6 weeks. The factor I won't have that will play into it will be the renewal from Humana. Okay, but we will definitely have very, very hard numbers when it comes September, because that's the latest. That's usually when Humana tells me they'll get it out. I think, to Squire Sebastian's credit, I think last year we probably decided to go ahead and go with a renewal maybe in August, because Humana was saying, look, if you do this now, if you promise not to shop.
It was in August.
Okay, all right, is there a motion to adjourn?
So moved.
Second.
All right. We're adjourned. Thanks, everybody. Thank you. Great discussion, and thank you, Jamie, and we look forward to hearing back from you. Thanks, everybody. We're adjourned.
Thank you.